PCOS from the live case from clinic. First, a case of a 17 years female. She is very active in the sports, lean and having the normal menses. All of a sudden, she had the severe bout of acne on the face. The medication was started and she was asked to get the sonography done, which suggested the polycystic ovary, and she was diagnosed as the lean PCOS. Similarly, a second case, a case of a 29 years female, married since 4 years. She is lean, having a hectic professional life. After 3 years of trying for a baby, could not get pregnant. Later, she was subjected to battery of investigation, which finally let us diagnosed as lean PCOS. Third, a case of 21 years female, studying in college, thin, having a regular period. Now since 3 months, she noticed there is a coarse hair growth on the face and other part of her body. Later on evaluation, we diagnosed as a lean PCOS. Yes, what have we noticed in last 3 cases? All the 3 females were lean. More or less they were very active life, even though they were diagnosed with lean PCOS. The lean people can too often be diagnosed as lean PCOD. We often associate PCOS with the obesity. Lean people do also can suffer from PCOS. Let us understand the lean PCOS in detail. On an average, we have seen the 5% of cases fall in the lean PCOS, and overall, even with the people with a normal weight, 20 to 30% of females having the PCOS, especially the lean PCOS, often get misdiagnosed or not diagnosed properly. The BMI of these females are always less than 23. Now let us understand what are the causative factors of lean PCOS caused by the abnormal fat and the muscle ratio. What do we mean by that? Normally when we see the lean PCOS female, they are normally thin, but the abdominal fat and the muscle ratio, there is a drastic difference. When we calculate the BMI, the person may be having a high BMI, like especially in the athletic and the gym going people, but they have a muscular part more. But what happens in the lean PCOS, we notice they may be having a less muscles and their abdominal fat is more. Second is the increased visceral fat and the central fat. It is thin, but they may be having a fat around the abdomen, and this may be the causative factor to increase the insulin resistance commonly seen in the lean PCOS. The third commonest cause in lean PCOS is the stress. The stress increases the cortisol, and the cortisol disturbs the androgen mechanism, and which causes the hyperandrogenism, which ultimately leads to the PCOS. The fourth is the sedentary lifestyle. Majority of lean PCOS are not so active in the exercise and the lifestyle, which ultimately can lead to insulin resistance and hyperandrogenism. Other is the wrong diet. With the advancement of our cultures and the lifestyle, majority of the lean PCOS are not taking the proper diet. Vitamin D deficiency. Vitamin D deficiency do causes PCOS. Gut inflammation. I have noticed the constipation, gut inflammation, leaky gut to be a cause of an lean PCOS. The last cause can be genetic PCOS running in the family. So these were the common causes which causes the lean PCOS. Now let us understand how can we measure the lean PCOS. Let us understand the various measurement scale. The first is the BMI. The BMI is the measurement of your height and the weight, which is the good measurement to let us know which category of obesity do you belong. Especially in the Asian country, the diagnostic criteria of BMI have been reduced because of the Indian people having the more obesity index, more abdominal fat compared to the western part. That's the reason anyone greater than 23 BMI is called as obese category. The next criteria to measure is the waist circumference. Anything more than 80 centimeters can lead to insulin resistance. The third good measurement is the waist to hip ratio. Anything more than greater than 0.86 can be classified as leading to PCOS. I have given all these 3 links in the description box. You can assess your own reading. There is waist to height ratio. This is also good measurement scale to assess your PCOS. degree. The other criteria are skin caliber, which is usually used in the OPDs to judge your subcutaneous fat, which is commonly measured on the neck and the scapular region. The girth measurement is also the criteria. The last one is the fat percentage machine, which you might have seen in the fitness studio and the gym where people measure with the 4-lead measurement scale. This is also the good index to measure the fat percentage. So these were the few tools where we can measure whether we fall in the lean PCOS or the obese PCOS. Now let us understand how can we differentiate between the obese PCOS and the lean PCOS. So what are the common signs and symptoms? Commonly, the first is seen the menstrual dysfunction. So this can range from amenorrhea, menorrhagia, painful menstruation. The other is the acne, which is commonly seen on the face, upper part of your chest and back. Hirsutism, the abnormal hair growth on the face and the other part of your body. Thinning of your hair. Acanthos nigrans is commonly seen on the back of your neck, axilla part where is a darkish velvet appearance. Infertility. So up till now what we have seen is the common in the lean and obese PCOS, the menstrual distribution, acne, hirsutism, thinning of hair, acanthos nigrans and infertility. So below the factors are more commonly seen in the lean PCOS, especially the stress levels are quite high in the lean PCOS compared to the obese PCOS. There is a high anxiety seen in the lean PCOS compared to the obese PCOS. There is a high LH level in the lean PCOS compared to the obese PCOS, and there is a reactive hypoglycemia more commonly seen in the lean PCOS compared to the obese PCOS. The reactive hypoglycemia are the sudden dropping of your glucose after eating. Say after two hours of your eating, you feel quite hungry. So these were the common signs and symptoms seen in the lean PCOS and the obese PCOS. Now let us understand how can we manage the lean PCOS. First, understanding the associated diseases like a female having the thyroid, diabetes or nutritional deficiency need to be addressed along with the PCOS. Next is exercise. Often notice the lean PCOS being on the thinner part, we can't advocate them the high intensity exercise because they already are on the lower side of the weight. But we do notice they do carry the visceral fat more. That's the reason there is insulin resistance and they are suffering from lean PCOS. So recommended exercise for them would be the strength training, building the muscles, including the yoga, and flexibility have shown a proven a good result in PCOS. Meditation, keeping their stress, anxiety level under control. It's a good part to include in the exercise. So next comes the diet part. They are already lean, so they would be thinking that they're having the good food, but more often seen they keep on binging the junk food, saturated fat. To increase their weight, on the contrary, they keep having the fried food, fatty food, ghee. Common recommendation for them, the diet would be to include some food like which is more sustainable, which is more seasonal, increase their muscle mass. There are few recommendations from my side. First, avoid sugar things. Timely eating is more important. Most of the time, the lean PCOS people are the young people. They suffer due to their job schedule, professional commitment, college going student. I would recommend having the food timely. The next comes including the lean protein in their diet, especially the plant-based protein part. Comes the portion control, having the diet in the controlled manner, including the protein, carbs and the fat in equal amount. The last is the sleep. Up till recent days, I was not giving so much importance to the sleep. Lately, I have understood the importance of sleep. Sleeping on time not only have shown the effectiveness of medicine response in PCOS efficiently, but it also makes the imbalanced hormone in tune. Now let us understand the treatment part. At our clinic, after the 15 years of lot of success and failure, we have designed the PCOS reversal program. This program addresses the problem from the root cause, that is the hormonal imbalance. We have laid down the proper protocol to assess your different types of PCOS and design the medicine accordingly. We not only addresses your acne, falling of a hair, irregular menses, obesity, but it takes in consideration of all your symptoms and addresses from the root cause. Our drugs are non-drug dependent. That means even when you stop the medicine after the due course of medication, the relapses of symptoms are not seen in most of the cases. By taking our PCOS reversal program, it not only addresses your current problem, but it arrests your further complications like diabetes, infertility, cardiovascular. So we came to the end of today's video. Hope you like it. Until we see you in the next video, keep moving forward. Bye for now. Take care.